EEG changes dynamically. There's some data from Solanki et al. In 2019 that support a potential utility of certain medications to treat epileptiform EEG activity in a subset of patients. So it's not a all or nothing kind of thing. It's very specific to the nuances of your patient. EEG findings on the ictal interictal spectrum. When we look at the seizures that last, that may not be physically manifested, such as non-convulsive status epilepticus, this patient may not be manifesting seizure, but their EEG may record seizure activity. And so we also then have to consider those patients, if they're in continued state of seizure, they would be in non-convulsive status epilepticus if this activity is lasting 5 minutes or longer. And the problem with that is the patient's depleting ATP, there's insufficient energy reserves, and that's just going to worsen outcome. If not recognized, if the EEG is not applied and treated, if you have a patient who is ongoing seizure activity, that can lead to poor outcome. So when we look at our awareness of non-convulsive status epilepticus, it really has increased over the last couple decades. And there are recommendations on if status is occurring that we get an EEG within 15 to 60 minutes. The Neurocritical Care Society had guidelines that were published in 2012 that spoke of this. This was related to status epilepticus. There's recommendations in the AHA, and also it is used, EEG monitoring is helpful in one of the many ways to look at neuroprognostication. Seizures do happen after cardiac arrest, as I mentioned, 1 in 3. They can develop early during the first 24 hours, or sometimes if you have them suppressed down to 33 degrees, you may not see the emergence of seizures until they are in the rewarming process as they're returning to normal thermia. Seizures, or that burden of seizures and myoclonus and things that happen, really reflect, I think, the severity of the brain injury. And that is mentioned in many of the articles. The early appearance of an epileptiform EEG were found in one study to have an increased odds for poor outcome. And so having EEG activity or having EEG monitoring enables the neurologist, your epileptologist, your neurointensivist team to really take a look and decipher what's going on in the brain and then make appropriate treatment decisions as needed.